keep your microphone muted. And for those who are on the panel, you can bring on the video and unmute yourself during that period. You can put any questions that you have into the chat box, and also feel free to introduce yourself in the chat box. This meeting will be recorded and it'll be archived on the SIHI website. The purpose of the event today is to introduce the TDR SIHI/Social Innovation M&E Framework, Monitoring and Evaluation Framework, and the research checklist, in addition to shining a light on monitoring and evaluation within the SIHI network. So we're first going to have some opening remarks, and without further ado, I'd like to turn things over to Maki Kitamura. Maki is at TDR, which is the Special Program for Research and Training in Tropical Diseases. She's the communications manager, and really has been important in terms of helping us with the communications parts of the M&E guidebook. So thanks so much for joining us, and over to you, Maki.
Thank you, Joe, and hello to everyone, and thank you for joining us for this webinar. TDR has been proud to be part of this initiative to strengthen research on social innovations with this monitoring and evaluation framework. As many of you know, TDR, in collaboration with several research partners, helped establish the Social Innovation Health Initiative in 2014 to advance social innovation through research, capacity strengthening, and advocacy. Our hope is that this M&E framework will be useful for innovators to understand the various factors that make their social innovations effective and sustainable so they can be scaled up. Because the COVID-19 pandemic has really highlighted the importance of community-led social innovations that can make a real difference in the response effort by overcoming barriers to delivering health services and engaging communities to identify and implement solutions. Our goal is to see social innovations flourish and multiply to help transform healthcare delivery, and we hope that this M&E framework will contribute towards that goal. Thank you.
Thanks, Maki. That was great. Next up, we have a few brief remarks from Dr. Kala Mehta. She's a faculty in epidemiology and biostatistics at the University of California, San Francisco. She's joined us from the very early PST time, and over to you. The Zoom mic is yours, Dr. Mehta.
Thank you very much, Joe. In my opening remarks, I'm really going to focus on what is the definition of social innovation? Why are we actually here today? First, let's start with the myriad of people who have defined social innovation, be it academics, business, non-governmental organizations. And when reviewing all of this, what strikes me is that virtually every sector has taken an interest in social innovation. Why do you think that is? Why have you joined here today for this brilliant panel discussion? Perhaps you consider yourself a social innovator. When we look at the definition, innovation typically conjures up thoughts of science, technology, and progress. And social usually means something that's that of society, in many cases touching parts of society that may be overlooked. When you put these two words together, social and innovation, several new ideas may emerge. And indeed, the social types of social innovations that we work with are far and wide, particularly now in the age of COVID. Some parts of social innovation focus on the process, finding different solutions together, and others really focus on how people come together. I think one central principle I'd like to share is that to be social innovators, you must believe in a few things. First, that social innovation is about creating something radically new. And two, that radically new ideas only stick if you can prove that they work. I bet if you are a social innovator, you are not satisfied with the old ways. You want to achieve a higher standard for more people in potentially more countries. You're not someone who wants to invent a product or a process just to have it fail or be removed the next year. So over the past year, the team at SIHI have worked together, bringing together people who are deeply involved in social innovation. And they have one goal: to make the process of social innovation better for you, the social innovators. The group has developed a seminal research framework and a research checklist, and these will be explained by my colleagues Anayi and Liz in the upcoming sessions. Though you are about to hear about a lot of detail, I have only one message for you, and it's pretty simple. In closing, I want to encourage each one of you to use these tools that you learned today to innovate, because social innovation is about creating something radically new, and radically new ideas only stick if you can prove they work. Go, innovate, and don't stop there. Prove that what you invented works so others can benefit. Thank you.
Wonderful. Thank you so much, Dr. Mehta. I love that perspective, and just rings true with SIHI ethos and sort of core values. So our next speaker will have our first presentation from Dr. Anayi Pakri. Dr. Pakri is a postdoctoral fellow at the London School of Hygiene and Tropical Medicine and a member of the SIHI M&E working group that helped develop this framework. She's going to introduce the M&E framework for us today. So over to you, Dr. Pakri.
Thanks, Joe. Can you grant me permission to share screen to start?
Are you able to share the screen? Okay, I think you should be ready now. Go ahead.
Hi, everyone. My name is Anayi Pakri, and I'm a research fellow in social innovations based at the London School of Hygiene and Tropical Medicine. I work in partnership with the WHO TDR and with SIHI, and I'm really excited to be introducing to you today our social innovation in health monitoring and evaluation framework. And in the course of my talk today, I would go through the need for monitoring and evaluating social innovation in health projects. I'll describe what we did, then introduce the framework and go through the 7 phases we have included in the document. I would also discuss some of the open access resources we have identified and conclude with thanks to our partners. First of all, monitoring and evaluation is needed for interventions in any discipline. This is to understand what works and what doesn't work. We have defined social innovation in health as inclusive solutions that address healthcare delivery gap that meets the needs of end users through a multi-stakeholder, community-engaged process. So social innovations definitely need a framework to guide monitoring and evaluation, as some of these innovations may be from disciplines originally outside the field of health. And until now, there has been no specific tool or framework developed specifically to measure and evaluate social innovations in health. Only very few examples have been carefully monitored and evaluated till date. Responding to this need, the Social Innovation in Health Initiatives, SIHI, in partnership with the WHO TDR, organized workshops which identified the need for social innovation monitoring and evaluation. Having identified the need, we employed a multi-step process to developing a framework for measuring social innovations in health. First, we organized an open crowdsourcing call for ideas. Secondly, we conducted a scoping review of the literature to identify what sort of information is out there for monitoring and evaluating social innovations. We merged ideas and outcomes from the open call and scoping review into draft documents, which was deliberated upon in multi-sectorial discussions and eventually finalized using an adapted Delphi process. The main purpose for this framework is to provide us with a monitoring and evaluation tool for social innovations in health. Now, monitoring and evaluation will help us to democratize research and eventually engage more stakeholders to work in partnership with researchers. This is co-creation. Now, the outcome of monitoring and evaluation obviously will help us understand the effectiveness of the innovations, the potential for sustainability, and also scalability. Now introducing the 7 phases of the framework, which is based on the Nesta 7 stages of innovation. Here we have used the colors of the SDGs to represent the different phases. And it's important to note that these 7 phases are iterative and interlinked to the co-creation process. In the actual document, we have highlighted the co-creation items with bold characters. So you see these across all 7 phases. And it's important to note also that the actual web document is interactive. So if you click on a particular phase, it will take you directly to that phase. You don't have to scroll through all the documents. So if you click on phase 7, you go directly to phase 7. So now I'll run through the phases 1 to 7 very briefly. So phase 1, which is opportunities and challenges, is come right at the beginning, which includes identifying a need and opportunity for social innovation in health. And I just want to quickly say across all 7 phases, we've put in 3 broad categories for key issues, specific techniques, and open access resources. So here in phase 1, you'll be dealing with identifying an unmet need, and then you identify the group of innovators, the end users, the partners, so sort of all of the key stakeholders. And specific techniques would be scoping reviews, systematic reviews, qualitative research, sort of like focus group or in-depth interviews. All of this help to identify the gap in practice. And then open access resources would include Cochrane Library, Prisma statements, and other resources for conducting reviews. So moving on to phase 2, which is generating ideas. This involves developing a social innovation project or a research study. And the key issues for this would be to build your team with end users, with the leaders, public and private sectors, so sort of the stakeholders, and then specify the end user population as much as possible. Who is this innovation targeting? Who is it going to be made for? And then strengthen collaborations with the end users. So these are sort of like co-creation ideas. Others include identifying your overall objectives, and then you develop your research objectives and build on existing structures. So the specific techniques for these key issues would include sort of like crowdsourcing open calls, challenges, hackathons, and then other user-led design thinking studies that are iterative. So sort of like participatory research, participatory learning and action, and open access resources that are particularly useful in this stage will include like a design For health, so a design process, we've identified our crowdsourcing clinic and our crowdsourcing practical guide that gives you tips on how to organize a crowdsourcing open call for ideas. And then other participatory approaches. Like I said, you click through and it takes you directly. So this is for phase 2. And then moving on, phase 3 leads on nicely from phase 2, which is developing and testing. So this involves piloting a social innovation in health project. And the key issues under piloting would be basically to test different ideas by building tangible products or creating experiences to gather feedback from end users. So sort of what works. And the project delivery staff and other key stakeholders. So here you also create clear and actionable metrics to test the innovation, and you satisfy other ethical and regulatory requirements. And for specific research methods or techniques, process evaluation, so usability and prototype research, all these come under. And open access resources will include qualitative evaluation checklist. We have the Nesta prototype framework, very useful. We have the most significant change technique. So phase 4 is making the case. Here you want to evaluate the social innovation project. So you want to assess the performance based on pre-established criteria and co-creation items here: community acceptability, usability, social and cultural impact, effectiveness. Other key attributes will be potential for sustainability and scalability. Specific techniques relevant for this will be observational studies, implementation research, social impact assessments, and we've identified also a number of very relevant open access resources, including the implementation research practical guide, the B impact assessments, and a handful of other helpful resources. And then in phase 5, you're delivering and implementing, which has to do with expanding the social innovation projects. And the key issues here is that you continue to test different combinations of interventions while collecting metrics on the impact and effectiveness. Here, you want to identify aspects of the innovation that can be expanded or scaled up, and the possible context for which the application runs. So here also, you want to develop communications and communication strategy and risk management. And also you want to integrate community voices and stakeholder engagement, very important in delivery and implementing. And specific techniques relevant would be process evaluation, economic evaluation. You might also want to employ some qualitative research, sort of in-depth interviews, ethnographic studies, and other participatory action research. And open access resources we've identified are the community-based participatory action research, which is a framework for conducting in communities. We have interactive time series analysis, cluster, randomized control trials, also observational studies, and a few other very relevant key resources have been highlighted in this phase as well. In phase 6, you consider growing and scaling. So you're either scaling up the impact for other settings, or you're scaling down for local relevance. And key issues will be to define longer-term metrics of impacts, including fidelity and other related implementation metrics. Research techniques will be things like social impact assessments, still implementation research, more of qualitative research, so ethnographic studies and the likes, in-depth interviews. And open access resources, we have identified the effectiveness implementation hybrid designs, social network analysis, discrete choice experiments coming here, and a few others we've put in. Phase 7 is changing systems. So here you actually want to integrate the social innovation into practice. So sort of the key issues will be creating a marketing and dissemination strategy. Then you also want to document and share the process. So specific techniques will be documenting best practices, impact analysis, Delphi techniques also come in relevant here, and we've also identified a bunch of open access resources helpful for employing these techniques, including the WHO best practices guide. Here I'll talk a bit about judging hackathons, which is an innovative participatory method we have employed in this project, but then it's increasingly being used in many medical and public health settings. So hackathons is a multi-stage process that brings together diverse individuals to solve a problem, and several types of M&A information may be helpful to judge hackathons. In our document, we've identified some key questions and considerations that would be relevant to assessing hackathons. So I'm just going to talk through this organized by stage. So the steering committee, you want to know how was the overall topic for the hackathon established by the SC? Did the steering committee constitution involve or include individuals with knowledge of M&A? Has the steering committee developed a hackathon plan that engages potential participants, sort of encouraging co-creation? Then the community engagement bit, was the hackathon disseminated in diverse forums to ensure broad participation? That's considering diversity related to location, gender, ethnicity, disability. And then judging innovations, sort of like, was this based on pre-specified criteria? Do judges include the end users or key stakeholders in the innovation? Do the judging criteria include an assessment of health and non-health impacts? And then recognizing finalists, what was the prize structure like? Did it provide mentorship or monetary support for monitoring and evaluation or scaling up of the innovation? So these are some of the considerations when reviewing or judging hackathons. So we've also identified a number of open access resources, very general. So things like M&A tools and training resources, implementation research resources, research, ethics, and then some reference tools like Mendeley's Zotero, statistical and data software, and other very general open access resources like the social innovation research checklists. We'll be talking a bit more after myself, our crowdsourcing clinic, and the global health network. So this is our M&E framework, very briefly introduced to you. And we'd like to say a very big thank you to all of our sponsors and partners and everyone that has contributed to the development of this framework. Thank you very much. Over to you. So I'm still going to take a few minutes to go through the interactive website and show you the website.
Thanks, Anae. While you're getting that set up, that was a really nice presentation. You very clearly, you've done a great job in sort of presenting the conceptual framework. And I will also put the URL that Anae is opening. I'll put this into the chat box. But there's an interactive version. I should also say that there's a PDF version, and it will be on the website shortly. It's not, it hasn't gotten, it's been approved, but it hasn't gotten to the stage where we can upload it on the website yet.
Okay. Can you see my screen?
Yep, looks good.
Okay, so this is our interactive website that hosts the M&E framework as well. And as you can see, we have the nice cover here. You have a menu, which if you click, it takes you to the different sections of the document. So you could just click to go to a particular section, or you could navigate directly from the home page by clicking on the Get Started button. and then it loads directly onto the next session. On each page, you have an icon to either go back to the previous section or advance to the next phase. But you can also jump to any particular section using the menu. So I'm going to just jump through to the framework by phase, which loads nicely here, which was what I introduced briefly. And here on our wheel, you can click on any of the phases and it pops up the items we have identified and included in that phase. The website link Joe has put in the chat box. There's also a video introducing the document. It's hosted on YouTube, so you can click through the website and watch the video as well. And if you go right down to the end, you have a section where you could send us any feedback, any questions or comments you have, or request a PDF by sending an email to sesh@seshglobal.org. So thank you very much. Over to you, Joe.
Thanks, Anae. That was wonderful. So our next presentation is going to be from Dr. Liz Chen. She's a faculty at the University of North Carolina at Chapel Hill, and she's also been part of the same M&E working group. And Dr. Chen is going to walk us through the research checklist. So over to you, Dr. Chen.
I'll need permission to share screen again.
Oops, sorry about that. Shufeng. There you go. I think you should be able to do it now, Anae.
Yes, thank you.
Sorry.
All right. One minute. Just bear with me.
Okay.
Hello, and welcome to the webinar on the Social Innovation Research Checklist. My name is Liz Chen. I'm an assistant professor at the UNC Gilling School of Global Public Health. I also serve as design thinking for the university through Innovate Carolina, our Office of Innovation, Entrepreneurship, and Economic Development. We define social innovations in health as inclusive solutions to address the healthcare delivery gap that meet the needs of end users through a multi-stakeholder, community-engaged process. Meetings previously led by the Social Innovation in Health Initiative, or SIHI, identified a need for research tools to advance social innovations in health in low and middle income countries. Why do we need a checklist? Research checklists provide a practical way to formalize and standardize reporting of research findings. They can increase transparency, improve reporting completeness, facilitate easier comparison of studies, and facilitate easier replication of studies. There have not been any research checklists put forth for social innovation to date. As previously described, we followed a three-step process in coming up with our research checklist. And our final social innovation research checklist consists of 17 items depicted here. Some of these items are more self-explanatory, like brief name, problem, limitations, and strengths, and others are more specific to the social innovation world. And so we will walk everyone through a case study in the subsequent slides. The example that we are using comes from a publication authored by Phyllis Awar, pictured here, and her team, and their description of a social innovation in Uganda, Imaging the World, Africa. And so in the following slides, we lay out 3 pieces of information. On the left, the item from the social innovation research checklist that we would like to highlight. In the middle, our checklist description of that particular item. And then on the right, sample information from Awar et al. On imaging the world Africa that relates to that checklist item. So for item number 2, problem, our checklist describes that we want folks to include information on the current context, background, and problem addressed by the social innovation from the perspective of the end user. The example from Awar et al. Offers that Uganda has only 1 radiologist or sonographer per 1 million people. Combined with the lack of advanced imaging technology and lower incomes, rural populations greatly lack access to diagnostic imaging services. For research checklist item number 4, social innovation. Describe the key components of the social innovation. This could be accompanied by a detailed description, a photograph, or a figure. Describe each of the processes, activities, and elements used in the social innovation, including any enabling or supporting activities. So some of the information put forth by Awar et al. For the Imaging the World Africa model includes that the model uses ultrasound imaging devices at the point of care and trains midwives and nurses who are not radiographers to conduct ultrasound scans. The scans are then securely sent off to offsite experts to review the scans using telemedicine approaches. Item number 5, end users. The checklist asks you to describe the end user of the social innovation and health. Describe how end users are also direct or indirect beneficiaries of the social innovation. So for this particular example, the end users are low-income pregnant women from rural communities in Uganda. Item number 6 asks for detailed stakeholder involvement. And so the checklist asks to describe how local stakeholders, including end users, are involved in design, development, implementation, and evaluation of the social innovation and health. In addition, describe the role of marginalized or vulnerable individuals or groups in these processes. And so from the Awar et al. Article, we were able to pull the following information. All of the stakeholders listed work together to implement the social innovation. Lower level government and private health facilities, which do not routinely practice imaging services, district health authorities, health workers / midwives who undertake imaging training in the service provision, expert radiologists in Uganda and abroad, and low-income mothers who are not able to pay high cost of ultrasound scan services in the private sector. Item number 10 asks for information about monitoring and evaluation strategies. The checklist asks you to describe what is measured, how, and when as a part of monitoring and evaluation. This includes measurement of health, social, and other impacts. Awar et al. Describe that data are routinely collected on selected service provision indicators, as well as pricing indicators for better service provision and for sustainability for the Imaging the World Africa social innovation. Item number 12 focuses on adaptability. So we ask you to consider how the social innovation could be adapted, scaled up, or used in contexts other than the one described if appropriate. So Imaging the World Africa has been expanded both in terms of geographic areas and the services they provide. The program was expanded to 6 other districts and a total of 11 health facilities by 2016. And ultrasound sonography was extended to include echocardiography in selected areas. Research checklist item number 13 focuses on financing. So we asked you to describe how the social innovation and health has been funded at design, development, implementation, and evaluation stages, and describe how the social innovation could generate revenue if applicable, or be institutionalized if applicable in order to be sustained in the future. Imaging the World Africa is funded through a combination of grants, as well as minimal client contributions for the service. Item 14 asks for health impact. So describe the health impact of the social innovation over a period of time and the methods to assess health impact. Health is defined broadly here according to the WHO definition. So Imaging the World Africa reports that results of obstetric ultrasound scans have contributed to improved management in about 23% of the total pregnancies among the women they serve. Imaging the World Africa has also trained over 150 health workers and conducted over 200,000 ultrasound scans since 2010. Data are used to aid healthcare decision-making for the individual pregnant women, as well as at the specific health facility level. Item 15 asks about social impact. Describe the non-medical impact of the social innovation over a period of time. This could be impact on the environment, social changes, or other non-medical impact. So for Imaging the World Africa, Awar et al. Noted that as a result of the innovation, there was increased husband or partner involvement in antenatal care services. And with increased awareness, families and husbands became interested in seeing their unborn child through ultrasonography and preparing for the delivery of the baby. Here's a preview of our social innovation research checklist. So similar to other research checklists out there, we have our item number, the name of the item, as well as a description of the information that we expect for each item, and then a blank space where researchers can then indicate what page number they report each of the items on. And similarly, here's our social innovators checklist. And so this version still includes the item number, the item, the description, and then a place where social innovators on the ground can then place a check mark after they've completed steps that are related to each of these items. And at this point, we want to acknowledge the contributions of the different agencies that have supported this work. And then conclude with the slide. We've developed a research checklist for social innovations in health with low and middle income countries in mind. This checklist can be used by public health and healthcare workers in the field engaging in social innovation projects and research as well. We hope that this leads to more reporting, greater transparency, and greater comparability and replicability of social innovations in health across low and middle income countries. And then lastly, if you would like to access a copy of our research checklist or the accompanying social innovator checklist, please contact Dr. Joe Tucker at the email listed here, or access the preprint version of our publication linked below. And these are our references. Thank you again for your time, and look forward to sharing more about our research checklist as we move forward. Thank you.
Thanks, Dr. Chen. That was excellent. It was a really clear presentation and highlighted the main components. Now we're going to shift gears a little bit and have a panel on social innovation monitoring and evaluation. We're fortunate to have a fabulous group of panelists lined up. First, I'm going to briefly introduce them and then jump in with questions. Jagan Kartik is a program lead at the Derby Foundation and which is now a social innovation and health hub in India. Dr. Uche Amazigo is a professor of medical parasitology in Nigeria who led the WHO's onchocerciasis program in Africa. She received the Prince Mahidol Award for outstanding contributions to public health. Omar Ibatuan is a nurse social innovator in the Philippines and a co-founder of The Boring Book, a mental health self-care journal that was recognized by the SIHI Philippines crowdsourcing open call. It was launched in Ilocos Sur province as part of World Mental Health Day. Dr. Luis Gabriel Cuervo is a senior advisor at PAHO and special advisor to the Social Innovation and Health Initiative. Dr. Weiming Tang is director of SESH Global and professor at the Dermatology Hospital of Southern Medical University in Guangzhou, China. Silvana Sinha is founder and chairperson of Prava Health, a brick-and-click healthcare platform in Bangladesh. She's also a life member of the Council on Foreign Relations. So what we'll do here is I'm just going to ask some of our panelists questions, very brief responses, sort of 1 minute back and forth, and we'll probably end a little bit after the hour. Apologies that we're running a little bit late. So first, I'd like to turn to Jagan, who recently launched the SIHI Hub in India. Congrats on the new program there. Your group is working on a whole bunch of different with a bunch of different social innovators. Some have research experience, others may not have a background in academic research at all. Jagan, what advice do you have for new social innovators who are interested in getting started with monitoring and evaluation?
Thank you, Joe, for the great opportunity and for inviting me to talk in the forum. So I agree. Some have research experience, and many don't have a background in academic research and even a business part as well. So my advice to the new innovators is to plan well in advance. So in three, four aspects, right? So from the day one, the innovators should have a clear roadmap on three things: product development, fundraise, and then the business strategy, right? And I would always inform the innovators, right? Whenever I meet, like always be ready with the plan B. So these even the whole world is facing, right? Like the any unavoidable circumstances, right? So we can be ready to face any situations. So but especially these monitoring and evaluation framework, right? What this session has prepared, it will definitely help innovators to learn and structure the roadmap from the day one. So for monitoring evaluations are essential components for social innovations in health, in order to focus the lens on what works and what does not work, right? And especially the frameworks are very well articulated in 7 categories, right? So to take instance an example, if any innovators are at the early stage, right, they can directly refer to the opportunities and challenges, and they can go and refer to some of the flow charts, what the team has really built, and that will give them the complete overall idea of the complete life cycle plan, right? From conceptualization till even to scale up, creating impact in the community, or how to even create a sustainable model or a revenue model, right? So this whole framework will definitely help the new innovators, or even if it is the late stage innovators or the mid stage innovators, right? So they can directly go to any relevant framework and learn much about it, much more, many things in this. And this framework or the monitoring and evaluation tool will definitely help to prepare a solid plan and help them to create an impact in the community.
Thanks, Jagan. That sounds great. Could you tell us more about the social innovation landscape in India? So what's the breadth and depth of social innovation for health in India right now?
So as everyone knows, right? Like, so India is the largest populated country in the world, and you can seek opportunities and you can find pain points everywhere, right? So the innovators, right? Like if they keep their eyes and ears open, so they can literally come out with a lot of innovations, right? And especially the Indian governments, right? Almost 4 to 5 departments at national level, they are working to support the social innovations. It's not only specifically to social innovations, but all types of innovations, right, irrelevant to the sectors. But huge amount of funding is allocated from each departments, and almost they are supporting 350 to 400 incubators or accelerators across India. And you can find 100 plus investors and a lot of angel investors, VCs, right, who are ready to invest in impact creators. And every day we come across a lot of innovations who are building with new technologies, right? And on the other side, in terms of infra, so there are a lot of research parks, lab facilities, working space, and a lot of academic side also. There are a lot of research happening, and even access to the community, right? And but I would also say that so even though a lot of efforts being put in that to develop the innovations, but still a way ahead to go, right? And a lot of improvement is also needed. And due to the technology developments, right, like many problems are being addressed and monitored, which is a good sign for the social innovation. People who wanted to start as well. So any international innovation, if they wanted to test or scale up, right? So I would say that like India is one of the best country to start with.
Thanks, Jagan. Really helpful. And I agree, lots of exciting opportunities. Now I'd like to turn to Silvana. Your organization has done some really exciting work with incorporating feedback from end users to iteratively develop digital health services. Tell us more about your metrics. How do you structure monitoring and evaluation, Silvana?
Thank you, Joe. Thank you so much for the question and for having me here. I really appreciate. I've learned a lot. Actually, it's been great to hear from everyone today, and really honored to be with this esteemed group. So we take, I think one of the things that healthcare providers often miss out on, especially in the digital health space, is the importance of centering care around the patient. We often get caught up with our own operational metrics so much that we forget that what we're really here for is to serve the patient, to make sure the patient feels heard, to make sure that the patient achieves better health outcomes. And I would just, Jagan mentioned that, in India, there are investors looking at supporting innovations. I have to say, I've been less heartened by that. I will say on the side of the private sector, I feel that there hasn't been as much support from the investor community across emerging and frontier markets to support innovations in care delivery. But anyway, that's another subject. Just to answer your question directly, as we've developed digital tools such as telemedicine, such as e-pharma, and we've also recently launched a virtual primary care platform, we are constantly really applying human-centered design approaches to getting user feedback. And when we say users, that's not exclusively patients, it's also actually largely providers. Because our doctors are not necessarily the most tech savvy either, and so really, I think that there's a focus often on creating really elegant user experiences, investing in UI and UX for patients. But I think it's equally important to make those investments for providers so that they're able to apply the protocols, they're able to track progress in a really meaningful way. So I hope that answers your question. I think that there's a lot more that can be said on this topic, obviously, but I think there's a lot that we need to learn from the private sector and the public sector to collaborate more on the types of approaches that you and your colleagues are applying.
That's a great point, Silvana. I think private sector, it's neglected, and sort of there isn't as much cooperation and collaboration as there should be. Could you tell us a little bit more about how some of the metrics that you've developed, how have those been used to iteratively improve your model over time at Prava Health?
So some of the metrics are really basic, right? Like, would you recommend this service to another patient? Just basic NPS, Net Promoter Score. But some of the metrics are, how easy was this to use? Do you feel your provider listened to you today? Do you feel your provider was empathetic? Did your provider answer all of your questions? Which are softer things, but they're very important. And as we know that when patients feel engaged in the delivery of healthcare, you achieve better health outcomes. Over the longer term, on the outcome side of things, we're really focused on hospitalization rates and really keeping people out of the hospital. And I think this is another challenge that we face across the region, frankly, where on the private sector side of things, there are a lot of perverse incentives in the system that drive patients to hospital care. And so one of the things we're really trying to do is, the irony is that on the public health side of things in Bangladesh, at least, Bangladesh has achieved tremendous progress in terms of social development indicators, really performing better on most social development indicators than any other country in the region by investing in primary care and by improving vaccination rates, by reducing child, newborn, and maternal mortality rates. But on the private sector side of the system and in the region, 2/3 of health spending is going to the private sector. Care is overly hospital focused. So the major metric that we try to track is hospitalization rates. It's difficult though, because we don't have a centralized national health insurance system. So it's largely based on patients' self-reporting of whether they had to access hospital care.
Got it. That's helpful. Thanks, Silvana. Now I'd like to stay in Asia, but move from Bangladesh to the Philippines. The Boring Book is such an exciting project. It was identified through a SIHI open call, and the basic idea is that during COVID, it's forced isolation upon many of us. So why not use this as a moment of introspection to structure diary entries and sort of creative ideas? Omar, could you tell us a little bit more about the Boring Book?
Yes, so thank you, and also to the whole team for having me here. The Boring Book, it all started because of COVID-19. Because of its...
Sorry, Omar, there's a little bit of a background noise. Is it possible that you're connected on 2 devices?
Oh, no, I'm just connected to one device.
Oh, now it's better. Go ahead,
Okay.
sorry.
Okay, thank you. As I've said, because of the COVID-19, because of its possible impacts, particularly to our mental health, we are in quarantine for more than a year now. So people are afraid of going out, classes were suspended, many people lost their jobs, and the fear of not being able to provide food on their table is huge. Face to face interaction became so limited also. So there were so many changes that happened. So with this, there's a huge possibility that our mental health could suffer. In my experience in public health here in the Philippines, I was able to observe how adolescents and youth became so open with their thoughts through writing. And I, for one, knows how writing can be a breather and fun at the same time. So as a youth, there's so much struggle one could experience, and not being able to voice it out or not having somebody to talk to is very challenging. With the book title, with just the book title, it makes you want to grab and open it because it's like a reverse psychology. If you're told that to touch it, you're gonna touch it because we are curious just like that. And also, this book is composed of three parts, which are all in Filipino words. We have the first part, the tiwasay, which means calm, kinaiya, which means self-expression, and then the third part is silakbo, which means burst of emotion, where illustrations of mental health from one of the organization of artists here in our province are being compiled. So basically, this book encourages its readers to just let it all out. That sometimes in life, you get angry, you get mad, you get your heart broken. You get to experience problems. You get to feel so much emotion that you don't know how to let it go. So this book is not your typical go-to books without you or without our readers. It's just a plain pages of words, drawings, and colors. But with its readers, it will create unique stories, good, unexpected stories that in the end you get to realize that you maneuver your own story, that every life story is meaningful no matter what, no matter how. So that is how this book became so boring. I can't even.
Thanks, Omar. And tell us more with the boring book. I know you've gotten support from different government agencies. How did Emily help you to build a case for the boring book?
Yes, the Provincial Health Office, headed by our Provincial Health Officer, Dr. Carmelisa Sixon, and our provincial government are very supportive in terms of innovations and new perspectives, especially now that COVID is here. So, with the approval of our boss and the help of our partners, Miss Alia Nicole Sayo, my co-creator, the Maris Art Guild for their artworks, and also our SK Federated President, the youth leaders here in our province, we were able to present this book to our governor, our local chief executives. And during that time, we had with us our existing statistics on adolescents and youth's mental health, where it reflects the mental health situation, status in our province, and shows the urgency and need to push through with this innovation. Also, apart from that, for us to be able to gauge the impact of this innovation, we devise a feedback. So this feedback, it's like a part of the package of the book. We made a feedback bookmark. So with this bookmark, it encourages the readers to send us their feedback because they will get an extra copy for their friend or for their loved ones, for their brothers and sisters. So it's like hitting two birds in one stone. We get to have their feedback, plus we get another plus one reader. So in that way, little by little, we get to cover more audience.
Thanks, Omar. So now I'd like to turn north from the Philippines to China. The recently released M&E guide was co-created by SIHI, TDR, and SESH. Wei Ming, could you introduce what SESH is and tell us a little bit about how SESH uses monitoring and evaluation?
Sure, thanks, Joe, for this great opportunity. As you may know, the relationship between some researchers in China and the agency project China. The aim of the SIHI project is actually to create more creative, innovative, equitable, and effective health service through using social innovation. As you may know before, we actually published a crowdsourcing practical guide with TDR Global before, and right now we are focusing on supporting other SIHI hubs to using these methods to improve health. So we not only we use the social innovation to develop interventions, but we also use different strategies to evaluate the interventions. For example, we have used lots of randomized control trials to evaluate the social innovation interventions. There are a few things to need to take into consideration when we try to use randomized control trials or standardized measures for social innovation evaluation. For example, when we want to use randomized control trials, we need to consider whether the social innovation intervention is feasible to be delivered, which means whether intervention is easy to deliver, whether it is feasible to the community, and whether it is acceptable to the target population or the audience. Only when this is feasible, it can be delivered or evaluated or further implemented later on. So when we have the intervention ready, we need to think about which kind of exact study design we want to use. For example, when we want to use randomized control trial, we need to take into consideration whether we should use a normal randomized control trial, like a non-inferiority trial, a superiority trial, or stepwise trial. This is actually depends on whether we have an intervention and whether we have a control group to compare to the intervention, and whether we want to see whether our intervention can have a better effect than the traditional intervention. So once we have this study design in our mind, we need to know what kind of key measures we want to measure for the evaluation. For example, in our health models, whether we want to promote condom use or promote HIV testing or promote other testings. We need to see and determine which kind of measures were used in the studies, because this is a key things we want to use for the evaluation. Only after that, we will need to know whether the intervention has effect. The other thing we need to take into consideration is the actual cost. Usually, when we want to implement an intervention, especially a social innovation intervention, we want to scale it later on. We need to see whether this kind of intervention is cost saving or cost effect than the traditional or other interventions. So this is typically the key things we need to take into consideration. Of course, we also need to know whether we have enough resource to take out or implement the evaluation. Because sometimes, like randomized control trials, is really time consuming and expensive, and the resource will determine what kind of method we need to use, and the time period we want to do the evaluation, and the sample size. This is actually few key things that we need to take into consideration when we do the evaluation. Thank you, Joe.
Thanks, Dr. Tang. And I know some folks may need to leave. We'll have about 5 or 10 more minutes. We have 2 more panelists and some concluding remarks. Our next panelist is Dr. Cuervo. He's really one of the godfathers of research checklists, and he was involved in many of the, in several sort of checklist development. And I'd be interested, Dr. Cuervo, could you tell us more about why are research checklists important, and how do you see this social innovation in health checklist being used?
Well, thank you, Joe. Checklists are important tools because they help with communications, having standards and transparency. they help to reduce unjustified variations or missing important things. For example, they're essential to reduce research waste in a way and to increase the value of research and innovations. So if we want to make sure that the research and the innovation backed by the research have a social benefit, as we were saying when we looked at the M&E plan, that they're effective, that are inclusive and sustainable, we need to have some way of guaranteeing that that information is embedded in the process from the beginning. So that is one of the reasons why we may want to use research checklists and monitoring evaluation checklists, for example. And we see this all the time. I mean, in transportation, we feel much safer, and it is much safer now that our pilots, drivers, captains use checklists to ensure that everything is in place before you take off. And that happens the same in research. You don't use it only to report research, you don't use it only to report a social innovation, but you use it from the outset to plan and know what information needs to be included there. A specific example, because social innovations because equity is so important to social innovations, you want to make sure that you are including data, that you can disaggregate information in terms of, for example, ethnicity and gender and educational level, or the social and economic status of the people that are involved, the beliefs, the different characteristics of the people involved in the process, and the people that benefit from the process. Having this information in a checklist kind of helps you to make sure that you are not missing those essential data, or processes like registering things, like making sure that the ethical processes are considered. So that, I think, is the main reason that you can use them, and you can use them throughout the process, and that you can use in considering the crowdsourcing calls, for example. That's one of the ways I can see that this checklist could be implemented, that it helps to streamline the crowdsourcing process, that it's used from the beginning when you are identifying the social innovations, and also that you can use it in a way of doing some foresight into how some of the new tools are going to be used. Silvana was talking about the use of big data and artificial intelligence, for example. I believe she touched on that, and that's the kind of tools that are so becoming so important to use. And it's good to have the sort of questions that you have in this checklist, so that you can focus on what are the impact of these sort of tools into the social innovations, because they are great means, but they are not the end. So that's how I see this integrating into the crowdsourcing processes and helping us deliver things and communicating them in a way that they are more useful to everybody.
Well said. Thank you, Dr. Cuervo. And now our final panelist is Dr. Mazigo. I'd be interested, just taking a step back and thinking about the big picture of social innovation monitoring. Could you tell us more about how you used monitoring and evaluation in your African onchocerciasis project?
Thank you, Joe, and thank you for having me. The African Program for Onchocerciasis Control used two types of monitoring. The first was when the program was launched and the strategy determined by the communities, which we call the community directed treatment with ivermectin, CDTI. If you Google that, you will see that on the APOC. This strategy was determined by communities, and the communities are the lead stakeholder in the partnership of CDTI. However, to monitor the distribution of ivermectin in the sub-region, we decided to create a independent monitoring. That was the first stage of monitoring, or the first type of monitoring that we used, independent. However, after a couple of years, we realized that communities, the end users, were not part of our monitoring process. And so we modified the independent monitoring and brought it to independent participatory monitoring. This second type of monitoring involved in each community, in each district, you will engage community leaders to be part of the international community monitoring of the distribution in the entire district. And not only part, they were members of the evaluation monitoring, but there were also members that prepared the final report of the monitoring. So we wanted the thumbprint of community members on the findings of the monitoring. So then later on, we then moved further and decided to create, we asked the communities to advise us on how they themselves can monitor their own part, that is their actions, their activities, their responsibilities and roles. And from there, we developed, with the help of communities in Malawi and Uganda, that was the communities or the countries that first came up with the strategy and the process of community self-monitoring. And these two countries, from there, we took up their strategy and the processes they had put in place. We pre-tested and we developed, we expanded to other countries, the community self-monitoring. And what does that mean? Community self-monitoring allows the community, empowers them to select their own monitors to determine who should monitor the program for them. They determine their own indicators. They carry out the process, and then they provide a simple report in any language they like, in local language, which they now submit to the health system. So, and this has worked very well for a number of years, and we were able to increase the number of countries and projects until the closure of the program at the time the program was supposed to close. So this is what we did at that time on community self-monitoring. Thank you, Joe.
Thanks, Dr. Amazigo. And I think you underline the importance of the community in these discussions and metrics. It's a really key issue. Thanks again. And thanks to all of our panelists and to Shufang, Anae, and Liz for helping to set this up, and to our M&E group. I'd like to turn things over to Dr. Meredith Pilar Labarda. She is the co-lead of the SIHI Secretariat, and she's going to give a few final remarks.
Thanks, Joe, and warm greetings from the Philippines and from the Social Innovation in Health Initiative Global Network. First off, let me start by saying that we at SIHI Global Network are proud to be part of this very relevant endeavor. And if there is something that this pandemic and all the community quarantine that has taught us, it is that we cannot continue to operate using old structures, processes, thinking in addressing the new normal. Okay, thus we at SIHI affirm that coming up with this practical framework and checklist to evaluate, sustain, standardize, and scale up social innovations is a very relevant and timely in this new normal era. So on behalf of all the SIHI hubs in the SIHI Global Network and of course the SIHI Secretariat, we say congratulations to the whole team of the Social Innovation Monitoring and Evaluation Framework and Research Checklist. And we look forward to using this research checklist and sharing this to all our networks. All the best and good day to all of us. Over to you, Joe.
Thanks, Meredith. So to kind of bring things full circle, going back to Kala's remarks at the beginning, do something radically different, make sure you measure it, demonstrate impact, and I think that's really a key part of social innovation in health, that we need to do exciting new things, and we also need to measure those things really carefully, and in order to build the program and sort of move forward. So thanks again to TDR, to SIHI, to SESH, to all the members of the SIHI Monitoring and Evaluation Working Group who created these documents. I also promised to put in a brief word for the new TDR podcast. It's called Global Health Matters. If you just Google TDR and podcast, it'll come right up. It's really an exciting podcast. And I think for many in the audience interested in global health, this would be relevant. And for everyone, please do check out the Social Innovation and Health website. The framework that you just saw is on the SIHI website, as is the research checklist. So thanks everyone for coming. Thanks again to our panelists and speakers. Really delighted to have such a great group of folks today. Thank you all.
Thank you, Joe.
Thank you. Thank you, Joe.
Thank you, Joe.
Thank you.
Thank you, Joe. Thank you. Sorry I came late.
Thank you.
Thank you.
Thank you.
Thank you.
Shufang, do you mind transferring the recorded file to seeing if there's a way to send it over to the SIHI folks so they can put it on the website?
Yeah.
Great. Great. Thanks, everyone. I need to run to the next call, but really exciting, and feel free to email us if you have any questions.
Bye.